I hope you can see my screen now. Is it visible? Am I good?
Yes, sir. Yes, sir.
Thank you very much, Shubham, and thank you for the entire team for working on a Sunday evening. And I know that it's going to be longer. Dr. Dilip, thank you for the opportunity. You squeezed me in, and I've got 5 minutes with you. The first question is first decade, a child with foosh fall on outstretched hand. All right. There is extension type of injury, supracondylar fracture humerus. The order of involvement in supracondylar humerus is anterior introitius, median, radial, ulnar nerve. All right. So AMRU, AMRU. All right. So when the anterior introitius nerve is involved, right, you can't do this wow sign or okay sign, also called as Kilo-Nevin sign. And this anterior interosseous is not in the options here. So you have to go with the median nerve. So FDP and FPL, these two, they do okay sign. And anterior interosseous is not there. So you mark median. But if AIN is there, that's a better answer. That was question number one. That came from that 70-minute session I've been requesting everybody. Patient with rheumatoid arthritis, which deformity is this? Right? Now, when you have this, you have to pick up which is the option here. Most of the fingers here, most of the students say this was the image. Our team also has collected this image, right? Now you have got flexion of the proximal interphalangeal joint and hyperextension of DIP. Okay, so here you will mark this as the botanier deformity. Absolutely correct, Rohit. Your answer is correct. All right, so you will go with botanier deformity. All right, coming to the third question. 60-year-old with generalized bone pain and easy fatigability. There is diffuse osteoporosis. Now, remember this. There are three osteoporosis that we always say. Patchy osteopenia, Sudex dystrophy. Disuse osteoporosis, right? Disuse is tuberculosis. Diffuse, diffuse osteoporosis is hyperparathyroidism. There are only two conditions in which there is high calcium, hypercalcemia. One is primary hyperparathyroidism, and the second is multiple myeloma. I've been telling this. Now, here it is parathyroid adenoma as a diagnosis, which is the commonest cause of primary hyperparathyroidism. That is why system may be scan. Come on, hearts for those who got this correct. Come on, my friends. Did you get this correct? Nice. 13-year-old boy has a waxing, waning, right? Pain and swelling over the mid shaft of humerus. You are second about, right? Second about the second decade of life. System maybe is better. Now, second decade of life, mid shaft, second decade, mid shaft. So you're talking about second decade diaphyseal lesion. Periosteal reaction suggestive of medullary involvement. अब यहां पर गेम घुमा दिया. What is the next best diagnostic investigation? Next best, next best. क्या था क्वेश्चन में? Was it next? What is best? और was it next best? बताइए जी. So orthopedics, X-ray is the first investigation. MRI is the next investigation. Biopsy is the best investigation. अब क्वेश्चन है नेक्स्ट बेस्ट. ऑल राइट, सो देखते हैं. अगर नेक्स्ट था तो एमआरआई होगा. नेक्स्ट इज एमआरआई. इफ इट इज बेस्ट देन द बायोप्सी. अगर कंफ्यूज करके नेक्स्ट बेस्ट लिखा है, सो दिस जस्ट मींस नेक्स्ट. सो एमआरआई. सो आंसर इज एमआरआई. Practically, it's going to be an MRI. All right, it's going to be an MRI. All right, next. A 30-year-old man presents with history of fall. Right, he has severe shoulder pain and inability to move. Abduction, external rotation of upper limb, anterior shoulder dislocation. Of lower limb after trauma, anterior hip dislocation. Down, the head is down and arm is out. So down and out. What is down and out? Come on. Down and out. Down and out. anterior dislocation. Beautiful. So down and out, anterior shoulder dislocation. This is what you should remember, right? And the last one, match the following. Come on, this is what we did. Cave. So cavus क्या है? What is cave? Cavus. Increased plantar arch. Cavus is increased plantar arch. Opposite of cavus is planus, flat foot. Equinus, plantar flexion. Calcaneus, dorsiflexion. So when I look at this, equinus is plantar flexion. Calcaneus is dorsiflexion. Planus is flat foot. Cavus is increased arch. All right, my friends. So these are the questions from orthopedics. All right. So do let me know if there is anything you wish to ask here. So exaggerated plantar arch is cavus. You have done your best, right? And now you have to surrender to God for the good, great result you will have. Let's expect a wonderful, wonderful result, and let's organize a wonderful, right? Yes, wonderful, wonderful meeting in Cerebellum.